Prevention and control. You've mentioned these things when I was talking about transmission. Reducing the risk of rodents to human transmission. That's reducing the risk of transmission from rats to humans. Limit contact with rodents population. um Promoting good community hygiene to discourage rodents from entering homes. Storage of grain and food in rodent proof containers, rat proof containers, um like containers that rats cannot eat. So it's like you should put food in those places. Maintaining a clean household, including disposal of garbage far from home. Safe preparation of food, e.g. by thorough cooking. um So food should be cooked properly, thoroughly. In the case that there has been exposure, generally food should be cooked properly and thoroughly. you know. African CDC's, this one is CDC. CDC says avoid eating these rats. We've mentioned that trap rats in and around homes. That's putting traps in rats, and note that I've talked about breathing in air. um that in breathing in air that infected urine or droppings of these rats. So if you are sweeping and cleaning a place where there have been rats, the place that have not been used, you are moving into an apartment, a lot of dust, a lot of things, and there have been rats in that place. The urine, excreta, all those things. As you are sweeping, you have to put on something, put on a mask, you know, proper ventilation, and be cognizant of the fact that in some cases one can breathe in air that has infected uh, rat's urine or rat excreta. So another thing is reducing the risk of transmission in healthcare settings. In healthcare settings, staff should always apply standard infection prevention and control precautions when caring for patients, regardless of their presumed diagnosis. So there are certain basic things that should be done, whether the patient has Lassa fever or have malaria, anything. If you're in a healthcare setting, certain basic precautions like basic hand hygiene, hand washing, very important. Use of use of hand sanitizers is important. Use of soap and water and running water is important. So basic hand hygiene, respiratory hygiene, you know, use of PPE, personal protective equipment, safe injection practices. Healthcare workers caring for patients with suspected or confirmed Lassa fever should apply extra infection prevention measures to prevent contact with the patient's blood and body fluids and contaminated surfaces or materials such as clothing and bedding. Laboratory workers are also at risk. Samples taken from humans and animals for investigation of Lassa fever infection should be handled by trained staff and processed in suitably equipped labs under maximum biological containment condition. So another thing, early disease recognition can improve survival chance and limit risk of transmission. In endemic areas, especially during the epidemic season, health workers should have a higher level of suspicion for Lassa fever in patients presenting with suggestive symptoms. Family members should always be careful to avoid contact with blood and body fluids while caring for sick persons. Patients suspected or confirmed for Lassa fever should be referred to a designated treatment center for early care. This point is important. I'll read it again. Family members should always be careful to avoid contact with blood and body fluids while caring for sick persons. Before I go to this point, let me just say something. It's a common practice we have, where if a patient is sick, irrespective of what the person is sick for or sick with, if the person is in the hospital, a large contingent of family members will go and visit. Children, adults, elderly, everybody will go and visit to show love and support to the person who is sick, forgetting that if somebody is sick in the hospital, that person could have a disease that's infectious. The doctors, the healthcare workers treating that patient may not know at that point that that person has that disease. They will be treating for other common things. They will be treating for malaria, treating for pneumonia, treating for bleeding in pregnancy without knowing that the person has a Lassa fever. And so I've mentioned this when I was discussing about Ebola. We should discourage this habit of when somebody is sick in the hospital, um not everybody should go and visit. If a family wants to go and visit, send a representative, send one person. It could be the mother, it could be the father. Don't pack all your children, young and old, don't pack them to go and visit anyone who is sick in the hospital for anything. The hospital environment, you can get illness. Some people go to hospital as if it's a tourist place. You understand? You see, you carry your child to the hospital and his child is playing on the ground and is picking things and rubbing and all of those things. That is very wrong. The hospital environment is a place where people can get infection, can get disease. Somebody can be sick of anything, goes to the hospital and catch a different illness completely, which may be even worse than what the person went there with. You understand? So when you have a loved one or a friend, anyone who is sick in the hospital, it's good to show support. It's good to show that you care and love the person. But don't carry all your children to go and visit the person in the hospital. Don't carry your loved ones. Children are more vulnerable because their immune system is weak. Their immune system is not strong enough, especially very young children less than 5 years old. Elderly people who have low immunity and all that. Pregnant women, if you are pregnant, you know, and you have a loved one who is sick in the hospital, you have to be careful because the immunity of a pregnant woman is not as strong because of the pregnancy. Pregnancy, for the body to accept the pregnancy. The pregnancy is like a foreign thing growing in the person. And usually when there's a foreign body growing in you, the body used to reject it. So the body is designed in such a way that the immune system is weakened in order to accept the pregnancy so that the pregnancy will not be rejected. That weakened immune, that's alteration in the immune defense to accept the pregnancy also exposes the woman to vulnerability, make the woman more vulnerable to infection. And when she gets something like Lassa fever, can be deadly for the mother and for the baby. So if you are pregnant, you shouldn't be the one to volunteer to go and take care of a sick person in the hospital. If you are elderly and you have diabetes, hypertension, and other things, if you have your immune system is compromised from a host of things, you shouldn't be the one going to take care of a sick person. If you are volunteer, if you want to send somebody to see someone who is sick in the hospital, pick somebody who is an adult, who is relatively healthy. Don't pick somebody who has a vulnerable health situation, because it's not when somebody is sick, it's not only by going to the hospital to visit that you show you support. If the person needs things, you can send money, you can send food, you can send messages of support, you can pray for the person while at home, you can call the person and show your support, and send in whatever you can send in. You don't need to physically go there. When the person is discharged, and the person is at home and the person is has recovered, then you can go and see the person at home. It's not everybody, the hospital relatives, so many. Sometimes you have to now put restriction on the timing of visits and all that, because people are so many, and it's causing a lot of problems and all that. Patients don't have time to rest. Patients are supposed to rest as part of recovery, and all that. So we should, as much as possible, discourage carrying everyone to go to the hospital to visit someone who is sick, especially if it's someone that is very sick and there is a suspicion of an infectious disease. You should be more careful. Somebody that is very sick, that is vomiting, having diarrhea, that the everywhere you have secretions, and all that, you should be careful. It should be noted, family members, as I've read before, should always be careful to avoid contact with blood and body fluids while caring for sick patients. If you have a loved one who is sick, eh, and the person is vomiting, having diarrhea, don't use your bare hands to be packing things. You can get a pack of gloves. You wear gloves. When you want to help pack things, wear gloves, you know. And when there is blood and body fluids, you have cleaners in the hospital, that can also assist. You can assist, but make sure you are gloved. The cleaners too should have gloves. There are gloves that should be proper industrial sized gloves that should be used by cleaners. Sometimes these things that we're talking about in terms of PPE, it should be noted that it's not only for doctors, not only for nurses and lab people. The cleaners need it. Security and those who are helping to carry the patient, they need these things. You understand? So because when there is blood, you are carrying a patient, person vomits and the vomiting is there, person is bleeding and the blood is there. Don't touch with your bare hands. Even if you are a loved one or family member, wear gloves, you know, wear face mask, wear appropriate, you know. While caring for someone else, take measures to also protect yourself. Because sometimes it could just happen that the person we are caring for may survive. The you who has now contracted it will now be the one to have a more severe illness. So that should be borne in mind. In the care of patients, we should be careful in order not to get infected with something like Lassa fever. Then Lassa fever in travelers returning from endemic areas. So like those abroad, in Europe, America, Australia, and other place, you come back to West Africa, you come for visit, or a foreigner coming to West Africa, you should take note of some of these things. On rare occasions, travelers returning from endemic areas were confirmed for Lassa fever. There have been patients that came to West Africa, you know, and then they contracted Lassa fever. They went back to Europe or to the Americas and they were found to have Lassa fever. But these things are rare, but it does happen. Although malaria, typhoid fever, and many other tropical infections are much more common, the diagnosis of Lassa fever should be considered in febrile patients returning from West Africa, especially if they've had exposures in areas where Lassa fever is known to be endemic. Healthcare workers seeing a patient suspected to have Lassa fever should immediately contact local or national experts for advice and arrange for lab tests. So if you are in other countries, where Lassa fever is not endemic, you come to West Africa where go to areas where Lassa fever are endemic, and when you get back you are sick, take note that one of the things they should consider malaria, which is more common, consider typhoid fever and other things which are more common, but also keep in mind If it's during the dry season, if it's during this period you're hearing of Lassa fever death, Lassa fever should also be borne in mind as part of a differential diagnosis. Safe burial for Lassa fever cases.